I'm Peter Block here at the American Heart Association annual meeting in Chicago for On the Scene, and with me is Mark Dare from Great Britain. He has just finished presenting not a trial necessarily, Mark, but an observation about what has happened in Great Britain after the discontinuation of all prophylactic antibiotics. So Mark, this is a curious, funny kind of observation that you have done. Tell me what you actually did.
Well, what we did was in March 2008, the National Institute for Health and Care Excellence stopped antibiotic prophylaxis in the UK. And what we've done is we've used hospital data to look back at all the patients in England to see who was discharged with infective endocarditis, both before the change and after the change. And we've also looked at antibiotic prescribing practices during that time to estimate the impact of the guidelines.
Okay, I actually was at your presentation, which was terrific. And then I will tell you that for the audience that this is a relatively straight line until 2008, and then it takes a quick upward curve. Now, is that a fair resume of what you found?
I think that's a fair resume. We found two things. We found firstly that the rate of prescription of antibiotic prophylaxis really fell away, and we only had about 10% of the level after 5 years that we had before the change. And we found an increase in the rate of change in the number of people getting infective endocarditis. So there's an increase over the baseline, more than we would have been expecting.
And did you split that up into high risk and not so high risk patients?
We split it up into high risk patients as per the sort of AHA criteria, and also into all the rest to see if we could differentiate any impact on these two groups.
Okay. So what do you think about this? I mean, is this just chance? Is this something that's real? Do you have any clue as to how you sort of winnow out what's going on?
We certainly need to do a lot more analysis. We've demonstrated that there's been a temporal association, but we certainly haven't demonstrated a cause-effect relationship. We don't think practice needs to change at the moment, but we do think that more attention needs to be paid to this.
Well, I will remind everyone that the U.S. guidelines say it's okay that high-risk patients continue antibiotic prophylaxis. But even in the U.S., we've been cautioned about using antibiotic prophylaxis in routine patients having dental work, for example, and so forth. So I guess the question is, Mark, how do you get to the bottom of this? I mean, if this is real, this is important. But if it isn't real and just noise, then we can forget it. So what's the next step?
I think the next step is to see if we can design a randomized clinical trial that we can actually complete.
Well, we're talking about hundreds of thousands of patients.
We are potentially talking about a six-figure number of patients followed up for probably 5 years at least.
Well, obviously that's the right way to get to the bottom of this. If any of you have lots of millions of dollars out there, send them to Mark, but thank you very much for being here.
Thank you, it's a pleasure.